People from ethnic minority backgrounds in England are nearly twice as likely to die with coronavirus than white people. That's according to the Office of National Statistics. Researchers believe a reluctance to seek medical attention may be a factor. An official study by Public Health England is underway to try and investigate. But one organisation is not waiting, hoping to tackle the problem for BAME communities by expanding access to free video consultations with doctors and nurses. Well, joining us to tell us more is Henry Otukumo, founder and CEO of Medics2You. Thank you very much for speaking to us. So it does seem that some communities are more vulnerable to this virus. How can some of the technology that you're piloting try to help solve some of those problems?
Right. Thanks, Rosie, for having me on your show. So with Medics2You, our platform is a fully integrated healthcare system that connects patients and businesses, healthcare providers with the UK-based world-class doctors and specialists anytime and anywhere. Our platform is we also provide a digital infrastructure that powers the provision of quality healthcare services for institutions in Africa, and our goal is to consistently deliver quality patient-centered care with measured outcomes. And with the outbreak of the COVID-19, we've had to reimagine our platform to try and help tackle the pandemic, so as to reduce, the mortality rates within the community.
So, what are some of the problems you're trying to help solve?
Right. So quite early in the coronavirus outbreak in March, when the virus was still classed as an epidemic, we recognized that there was a potential that the BAME population in the UK could be adversely affected by the events that were about to unfold. We observed that there were misconceptions and misleading informations spreading within our communities, and it was obvious that should we delay in providing a solution for this problem, that the end result could be very, very fatal. So we came together as a team, a very, very agile team. We have a Medics2You, and like I said earlier, to reimagine our platform and provide BAME-specific community-based service to help dispel these misconceptions and encourage people to adhere to government guidance on preparation, isolation, social distancing, and also to get timely COVID-19 medical advice based on the government's guidelines.
You're providing sort of online consultations, is that how it works? You can do it through a computer rather than having to meet someone in person. You've said that there is a reluctance from some people in that community to go and speak to doctors. Why is that?
Right. Early findings thus far suggest that there's a general reluctance within the BAME community to engage with conventional medical services, and the reasons are multifactorial, but by and large, anecdotal evidence still suggests that the reluctance is caused by a number of factors. So one is language barriers. Second is cultural practices on the use of traditional remedies over synthetic drugs. Third are various religious beliefs. And lastly, I would say, is the fear of being socially stigmatized.
And so this Medics2You is trying to facilitate some of those problems. Thank you. Well, to try and find solutions to some of those problems. Henry, thank you very much for speaking to us. Henry Otukumo, founder and CEO of Medics2You.